don't want to know. I don't care. You know, one of the first calls. A gentleman who actually was one of our first cases in the Lakewood area. Mm-hmm. His sons wrestled for me, and he looked. I was like, whoa. You know, is this? You know, nobody knew it was Mark.
Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. Funding for Chautauqua Sunrise is provided in part by the Chautauqua County Industrial Development Agency, with offices in Jamestown, Dunkirk, and Westfield, helping businesses to prosper throughout Chautauqua County.
The Chautauqua Center.
Are you looking for affordable medical, dental, or counseling services? The Chautauqua Center is always accepting new patients at their Jamestown and Dunkirk locations. They offer discounted prescriptions and accept all insurances. From the Access Chautauqua Studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Chautauqua. We are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week from 9 to 10 a.m. Send events via email or call us live. Check us out on YouTube and Facebook. And now, from the Access Chautauqua Studios, it's Chautauqua Sunrise.
Hey, good morning, everybody. I'm Doc Hamels, and a happy frosty Saturday morning to you. 39 degrees this morning. Woo, I put my wool hat on. I haven't worn that, seems like, since July. Just a little joke. It seemed like we had the longest winter there, didn't we? It was right into Mother's Day. I think I even have a picture. I think it was 5/8/20. There was snow on my truck. I still have that in my camera. Weather has been really quite phenomenal up till recently, but you know, I checked with my Siri here on my phone. I said, well, what's the last day of summer? I found out tomorrow is. So we got today and tomorrow, folks. Celebrate summer, but it's definitely feeling like fall out there. Yikes. The trees are starting to show a little bit of color, and well, here we are anyways. So if you're new to Chautauqua County, I got to tell you right now, you're in for a treat. Chautauqua County in the fall is absolutely gorgeous. Be sure you drive around. And I got something I'm going to share with you from Todd Tranum here in a little bit. He talks about Chautauqua County and just what a gem we have here, huh? Okay, so let's see where we're at. I want to say, first of all, good morning to everybody across the world that are watching. If you're streaming live with us, thank you. I hope you leave us a little note or a like, and we check it out, and then we see where you're from, and that's just a lot of fun. I always tell my guests we have maps behind us. Well, you actually can see this one over here. See how I did that? This makes me crazy when I have to be in reverse. I'm watching Well, anyways, there's a map over here. There's a map over here that we keep track of where we have people watching from around the world. So anyways, good morning, everybody. Also, good afternoon. Good afternoon to all my listeners on WRFA 107.9, low part of the people. Thanks for joining us Tuesdays at 1 o'clock. And of course, if you want to watch this show again, you can watch us on Spectrum 1301. And we are on at 2 and 8 every single day. Hard to believe. We're in our 7th season. Today is show 325, Justin. Yeah, we're getting there. We're getting there. All right. If you have a comment, a question, you have a concern, that is nice, no swearing, give us a call at 716-753-5225, and you can call us basically anywhere from in the world if you want. And my guest is here today. We're going to be talking about the heavy topic, of course, of the pandemic. We have PJ Wendel in the house, and he's going to be joining me shortly. We're going to talk about where we've been, where we are, and where we're going from his perspective. And this is a pretty heady subject, and it's something that I've been tracking along with all the other media folks the last 6 months. Okay, a few things to share with you. As you know, we did a series of public service announcements back in March, as it turns out. I had to look up the dates. I couldn't believe it, but that long ago, called Chautauqua Strong, where we talked about the pandemic and how to handle it and what to do and what not to do. And then we developed a series called Chautauqua Strong and Healthy. And it's about exercise, Tai Chi, and eating healthy and being active in your community. So those are being aired right now, every day at 4 and 10 here on Access Chautauqua. And this week, we're featuring Irene Terryberry and Dr. Ann Servos, and they are leading you through some Tai Chi movements. I've done Tai Chi. It's a lot of fun. It's very therapeutic for many people. Last week, we had Nancy Dunbar with Healthy Bones and doing regular exercises and stretching. And then coming up in the next 4 weeks, we're going to have Carrie Skelton, who will be doing some cooking with you online. So check it out. You don't have to get out of the house. You don't have to Zoom. You just got to watch us here on TV. So check us out. Always remember, if you missed a show, it's on YouTube forever and ever, as long as YouTube is alive. All right, coming up next week, I have the honor, let's see, 2, 4. I'm going to be, as far as I know, interviewing 8 political candidates for various offices right here. It's not going to be aired at that time, but I believe it's going to be taped, and then Chris does his magic to make it look nice and all that sort of thing, do a little editing, but you're going to have an opportunity to hear an interview with me with all the various candidates. The reason why I like this format is because it's what's the word I want to say, combative. I used to run the debates, and we would get a little heated here. But this way you have an opportunity to meet the candidates in a relaxed, rather informal setting, and you get to hear a little bit about themselves and why they want to hold various offices. So stay tuned for that. That's coming up. Chautauqua Candidates, that's Chris Burt's production. All right. I have some announcements I want to go through here. And let's see. Boy, I don't know if I have allergies to this room or what. I'm all like sinus. Did your father get rid of those ragweed plants he had out back? Jeepers. Okay, let's start out with a bunch of announcements here, and these are kind of interesting, and you may or may not be involved, but we're going to do it anyways. Let's go to slide 15, Jeff. Pedal for Polio event. Okay, as you know, I'm a Rotarian, and I'm very involved with what goes on in our area. So, for those of you that are cyclists, October 24th, there's going to be World Polio Day. So here we go. Bicyclists, donors, and sponsors will unite in America and Canada on both sides of the mighty Niagara River on October 24, known as World Polio Day. The ride will begin during the morning hours of Saturday the 24th near the Aquarium and Discovery Center on the American side of the falls and ends with a grand cannon bang and socially distant barbecue at Fort Niagara in Youngstown, New York. On the Canadian side of the Niagara Falls, The cycling venture will begin at the Rainbow Bridge and culminate at Niagara-on-the-Lake, where another resounding cannon blast will be heard, and an outdoor picnic will also be held. The Best of Friends District, which is what we belong to, Rotarians and community members will pedal for polio eradication with the assistance of sponsorships and donations. Follow COVID-19 guidelines. The cycling event will be limited to 2 members from each of the Rotary District clubs in our area. Rotary International is a founding member of the Global Polio Eradication Initiative and has reduced polio cases by 99.9% since its first project to vaccinate children in the Philippines in 1979. More than 2.5 billion children in 122 countries have been vaccinated due to the valiant efforts of local and worldwide Rotary clubs. At the present time, Rotary has contributed more than $1.8 billion towards eradicating polio. Rotarians will continue to fight against the debilitating and paralyzing disease until there are no new cases diagnosed throughout the world. Folks, polio was the pandemic of its day, and there were like 350,000 new cases every year. And polio maims people, it paralyzes them, it does all types of horrible things to the body. And I'm happy to say, as a Rotarian of many years now, that we've done our share and raised a lot of money. And so this is really a great event. So if you're interested and you're a bike rider, you'd like to do this, give them a call at 484-8814, or you can go to rotary7090.org and look for the story on Pedal for Polio. All right, let's go to 16 now, Jeff. Step Up for Autism is going virtual this year to help raise funds and awareness for those with autism spectrum disorder in our community. You can register at stepupforautism.com or call 661-1477 and choose to run, walk, bike, paddle, or row. Sounds like fun. Proceeds from the Step Up Autism go to Filling the Gap Incorporated. Most of the money raised is directed to the Success Program and other programs which provides social skills training to youth with autism. A lot of people don't realize that autism is an area that we didn't think about a lot years ago, but it's very prevalent in our society and misunderstood. And there's some wonderful people with autism that are doing great things, and lots of folks that are afflicted with autism that could do better with this kind of support. So think about that. I mentioned I got a commentary from Todd Tranum that I'd like to read because it's sort of, well, I'm going to use it for a springboard for our conversation here in a little bit. But this is from Todd from the Chamber of Commerce, and he's the executive director of that, as well as the Manufacturers Association of the Southern Tier. Okay, these are his words. As we watch with anxiety and grave concern while large portions of the western United States burn in wildfires, hurricanes batter our southern and eastern coastlines, he starts out cheery, and the coronavirus pandemic continues to rapidly infect and take the lives of Americans in a number of communities across this country, we are grateful to be living here in Western New York 2020. It will certainly be, this year will certainly mark itself in history books as a year in which our nation and the world face significant social, environmental, and health challenges. While we pray for the people in communities who are enduring this suffering, we also recognize the fact that here in our little corner of New York State, there is much to appreciate. And I say this all the time. We have businesses that are rebounding after the shutdown earlier this year. Our local business community has once again demonstrated its resilience and ability to innovate. We have watched this past year as companies large and small redesign their business models to suit their rapidly changing needs of customers. Manufacturers innovated to help provide personal protective equipment. Restaurants adapted the way they serve customers. Frontline workers in healthcare and a variety of work settings adjusted their normal work routines to make it comfortable and safe for their customers. Despite a struggling economy, there are businesses in Chautauqua County ready to hire. Let me say it again, they're ready to hire personnel to yet struggling to find the people they need to fill open positions, so there's jobs still available. We are surrounded by natural beauty and access to the great outdoors through parks, lakes, and four-season recreational opportunities. While our local theaters have not been able to reopen yet, most museums and cultural institutions have found new ways to put programs online and provide safe environments for foot traffic. With perseverance, creativity, and a focus on safety, most of our local attractions have found a way to provide programming. And that's true. Despite a recent increase in COVID-19 cases in western New York, we remain far below many parts of the country. Yet our percentages here are still much lower than many other states as we see outbreaks continuing even in other parts of rural America. We don't take that lightly, and it's an indicator that our caution here is working. We've said that right along for months now. We continue to strongly advise mask wearing and social distancing, and that businesses continue to implement and remain cognizant of state guidelines. Those guidelines are keeping you and me safe and keeping our business and schools open. I can't stress that enough. Challenging times are often the stimulus for innovation. As we do a lot of hand-wringing in our area pertaining to population decline, we need to consider whether this is a moment when we can flip our script. Consider for a moment that the pandemic and natural disasters may significantly change the way people view their quality of life and where they live. What can we as a community do to make the most of our welcoming county? How can we better make room to build our assets? Will others see Chautauqua County as a more advantageous place to live or open a business? All questions. Can we stem the flow of our migration in this region by being a safe, welcoming, and innovative place where businesses will thrive? These are the questions we will ask and should ask ourselves now, and then we should be developing action steps around these answers. We already offer an exceptional quality of life and affordable living. The time may be ripe to begin to take advantage of our assets here. And as the old Oriental expression goes, from crisis comes opportunity. Those are my words. So Todd, thanks for sharing that with me and the rest of the media and folks here in Chautauqua County. You pretty much said what I was thinking. Okay, a couple more, and then we're going to take a little breather here. Let's see, the chamber, no, that's not what it says. Chautauqua County Family and Caregiver Support Group Services, a welcoming environment for parents, family members, and other caregivers of individuals with developmental disabilities to meet, share experiences, and ask questions and receive support. Chautauqua County Family and Caregiver Support Group has an online Zoom meeting this month, and that's going to be this Thursday, September 24th from 6 to 7:30 p.m. If you're interested, give them a call at 332-4170. 332-4170. Okay, continuing on, there's something that's going to happen the following evening on September 25th, and it's called Prevention Works in Star Search Productions, a trivia night. Join Prevention Works and our host, Julia Sowery, in our first time ever virtual night event. Topics are from the hit TV shows, The Office, and Friends. If you're interested in participating in this fun activity, give them a call at 664-3608, 664-3608. All right. Okay, another one coming up soon. Seems hard to believe October isn't that far away. Friday, October 2nd, 11:30 a.m. till 5 p.m. The Resource Center over at 200 Dunham Avenue in Jamestown in their rear parking lot are going to have a Step Up for Autism Chicken Barbecue fundraiser. Sounds like good time, and that's the right time of the year to have a chicken barbecue. Each dinner will include a half a chicken, macaroni salad, barbecue, baked beans, a dinner roll, and butter. Justin, take your dad out for dinner. Sounds good. Okay, so you can do prepaid only, drive-through, takeout only, purchase tickets, candy, caramel apples, a whole bunch of stuff. And let's see, hang on a second. I'm just trying to see if there's a phone number you can call. Gosh, I don't have one. All right, well, you can go to, oh, there isn't one on the screen? All right, let's see. See if I can find it here. I don't see it, Jeff. Okay. Well, anyways, you can call the Resource Center, and they'll give you more information on that. Okay? All right, let's continue real quick. Let's see. Gambling, what's the problem? Sign up today for Prevention Works and Western Problem Gambling Resource Center for a virtual training about gambling. What's the problem? This is more prevalent than most people realize. Problem gambling can be defined as gambling that causes a problem in a person's life. While gambling is widely accepted in our community, problem gambling can cause personal, financial, family, and career issues. In some instances, problem gambling becomes an addiction called gambling disorder. Nearly, listen to this, 668,000 adults, not in the United States, in New York State. 668,000 people in New York State struggle with gambling issues. So if you're interested, September 29th, 2020, and you can sign up. And again, you can give them a call at Prevention Works. And where do these phone numbers keep going on? 664-3608. All right, and let's just see if there's anything else I want to talk about. Oh yeah, let's skip ahead to number 20. Oh no, this one's an important one. Nope, I'm not skipping ahead. Slide 21. The walk to end Alzheimer's is critical to supporting research for an effective treatment and a cure for Alzheimer's disease and other dementias. All right, the disease will affect 1 in 3 people over the next 85. They're over 85 years of age. 1 in 3 if you're over 85 years of age. Wow. So most of us know that we will know someone who is struggling with cognitive impairment or dementia. All right, there's going to be a walk October 10th, a Saturday, and it's going to be an online walk. But right now, I'm just going to let you know that it's going to be October 10th, and if you're interested in getting involved, sponsoring, making a donation, and I'm proud to say Chautauqua Sunrise is a sponsor for Mary Ann Spanos, give them a call at 753-4471. I'm going to skip that, and I'm going to go to number 23, Jeff, and then we're going to wrap things up for today because I want to get to my guest. All right, let you know the 2020 Virtual Gold Rush, the Westfield Mayville Rotary Club is having its virtual drawing. I'll be emceeing that online. We're going to be streaming live, and we're going to be on Zoom as well. The grand prize is $1,000. Second prize is 48-inch Samsung Smart TV. Third prize is $100. And there's a whole slew of $25 gift certificates that you can win. If you want tickets, give Tracy Bennett a call over in Westfield, or you can contact me here at the studio. Buy your tickets. They're $25 a piece, or if you get a group of 5, they're only 20, so 5 for 100. That's it. I'm out of breath, so we're going to take a quick break and stay tuned. I'll be right back. Oh, come here.
Mom, can we get some ice cream?
Please, Mom, please.
No, we're having dinner soon.
Please.
You don't have to be perfect to be a perfect parent. There are thousands of children in foster care who will take you just as you are.
Okay, we're back. Okay, so my guest, he took over his job in January. Thought, well, this is cool, new professional development opportunity. And then this thing in March came along, and well, let's take it from there. P.J. Wendel, good morning, our county executive.
Good morning.
Did you think, oh my God, what did I get myself into?
No, not really. You know,
I would have.
You know, I like challenges. You know, and I look at things, and I've said this. You know, I don't really share a lot, but you know, sometimes it's if not when, or if not now, when. You know, and if who, why not me?
Yeah.
So you know, when this all came about, you know, if you put yourself in faith or how you believe in things, that things happen for a reason. And, you know, as I went through this, you know, I was put here, you know, with experiences that I've had, you know, in the fire service. I've been an EMT. My wife's in the medical field. So, you know, I've worked with several of our people on my staff right now as my response team. So it happened. And, you know, you could, you could look at it and complain, or you can take it and make the best of what's happening, and that's what I chose to do. I think one person said, "Your message is too happy. You need a little bit more." They said negativity. I think what they're really referring to was more factual. Maybe really relying on this, and I likened it to, as a firefighter and EMT. If you look into somebody's house is on fire, you could, woe is me, and different things happen, and you can complain. Or if you walk into somebody's house, you could say, oh, this is a horrible situation. What do I? Or you can just make the best of what's there, and that's what I chose to do. And I surround myself with great people. I have a great support staff with my family, but more so the people I work with, my office staff, my response team, as I've affectionately called them over this last several months. Just great opportunities and great people. So, you surround yourself, you stay focused. And the big things seem small after a while.
Yeah. Well, on behalf of myself and my family, I want to thank you and your support team for keeping us in the loop. I was kidding you a little bit that I live in Battalion 2, and it seemed like forever we didn't have any outbreak whatsoever. We were holding strong. I was watching all the other battalions. I go, we're out here in the country, and then on the next day we got our first case and our second case, and we're like everybody else. It's going to happen.
Yep. Yeah. It was interesting. We were watching it, and I have a close friend of mine, and they were saying, how are we? That was the first question they asked every day. I'm like, still, you're okay, and then, it was really interesting because what we were finding. And I reached out to Kathy Thalkemper, the county executive from Erie County, Pennsylvania. And their easternmost parts of Erie County and our western part, the 2nd Battalion, had no cases.
Yeah.
And, whether it was something in the grapes, the water, the airflow off of Lake Erie, we didn't know. But, for the longest time, those areas remained, I guess, kind of infection-free for a while. But like everything else, it's here, and we'll make the best of it.
So you have kind of an interesting perspective. I didn't know you were an EMT. Are you still an EMT?
Oh, yes. Yep, 26 years.
Wow. Well, congratulations, and thanks for your service there. So you've been looking at this probably through two different lenses, as someone that's a first responder and also as someone now that's in charge of a system. So who's your response team?
Right now, it's Dr. Bob Burke.
Yep.
Dr. Michael Falk and Dr. Brian Walters. All three are medical directors. The latter two are medical directors for our EMS, Chautauqua County EMS. I've got John Griffith, our emergency services director.
Sure. I know John. Yeah.
Sheriff Quattrone.
Yep.
And Christine Schuyler from Department of Health and Human Services. Steve Abdella is our legal. He was on early on, but a lot of this, as it transpires, he hasn't necessarily been in the meetings every time. But
sure.
Any issues, he's my right hand man. So I go to Steve.
Oh yeah.
With a lot of questions.
Yeah, and people don't realize that there's certain things you can say and do, and if you don't do them correctly, now you've got yourself in a legal bind. But lawyers or attorneys have, well, for me personally, when I was in education, really kept me out of trouble. You want to come out like gangbusters sometimes, and they're the ones that pick you up by the back of your shirt and just get over here, settle down.
Yeah.
slow your motion here a little bit, your groove. So, PJ, what was it like the first week or so when this all hit for you? I mean, most of us were going like, okay, it's in down New York City, okay, it's over in China, okay, but then it got serious, didn't it?
It did, and yeah, it's kind of funny. I've got a chill right now as you asked that question.
Yeah.
Everybody asked. We heard it. We kind of watched it, if you will. The thing that's referred to, it's this invisible war.
Yeah.
This invisible catastrophe. So we knew it was coming. We'd met. I remember one of the first meetings was a Wednesday or Thursday afternoon over at DHHS, and Christine Schuyler and her staff said, this is happening elsewhere. We were keeping an eye on it every morning. I'd watch the news, and Westchester County, and it started to boil and fester, and Dustchis, and then Orange County. So keeping an eye on it, and then all of a sudden it started getting a little bit more closer to home with Erie County, and I refer to it as the day of infamy. It was March 15th. It was a Sunday, and ironically, it was just kind of one of those things. Sunday morning for me, I go to Mass. It was at St. Peter and Paul Church, and Father Mendy had started talking about it, and I raised my hand, and I said, do you mind if I address? And he was like, certainly. And I kind of informed everybody, where we were headed, because we had meetings Thursday, Friday, Saturday, and tried a conference call. Well, if you have 20 people who all have input, a conference call is challenging. You stepped on a lot of toes. So we got together and said we're going to meet Sunday, 1 o'clock, at the EOC, right down at the other end of the building here. And 25 people came in, and it was, great minds. We all were on the same page. And as we progressed, we just took what was happening. And, on one end of the phone was David O'Rourke from BOCES. He's like,
Yep.
the superintendents are waiting. And again, 25 years in education, the same people I worked with are like, well, what's your decision? I'm like, a month ago I was listening to you. Now you're listening to me. It's just kind of funny how things change like that. But, we made a decision that was based on science, based on the data, and what was safe. And, we made our declaration on that Sunday. And my phone, my children are at Southwestern. I was still a teacher and on the message board at Falconer. So in the middle of my press conference, my phone's vibrating and blowing up that these schools are all canceling. So it was that day of infamy. But, we made those sound decisions. And every day for that next week was, as a teacher and still to this day, I leave my house at 7 o'clock every morning. And I'm in the office. And that's how the first week was, every day, Monday through Sunday. It wasn't, because I got in there and with communication and so forth, you could do it at home, but I like to get there and focus on my job. So when I'm in that office, that was like my command center, I called it. We, in listening to other people that were across the state, they were kind of lauding, well, my EOC's in one building and my Department of Health is over here. And it's like, we were already there. I mean, that was great. We had a great setup. So, I got to work every day, and they were long hours. And, that's where I focused everything, was just getting in that office and, doing what I needed to. And I wanted people to see that, when I was working, that was in my office. It wasn't, sitting at home as if maybe some people question is how seriously we were taking it. But if I gave and got into my office every day, that people would realize that this is, pretty important. So the first week was challenging, but you learned, conference calls and Zoom meetings and everything else. That was, it was unique. That first week was pretty challenging.
I was sitting in Cherry Creek on March 14th or 15th. It could have been the same day.
Yeah.
And I was playing, because I'm a musician, and I call it the St. Patrick's Day Massacre. I was like, it was getting serious, but everybody was sort of like, well, is this a big deal or not a big deal? And then the curtain came crashing down, and everything just stopped. 1 second. Justin, could you give me a cup of hot tea? I don't know if you saw that or not. Okay.
I think that's what people maybe thought it was serious. They canceled St. Patrick's Day.
Yeah.
So it was wow, the Irish holiday was canceled. So yeah, it was. But I think that point, it's when, and certain things throughout this, if you look, I look almost monumental as to how and why they happened. But I think that being so close to the St. Patrick's Day, and we stopped, and I think that's when people said, "Wow, this is
real."
serious." Yeah.
So here we are in Chautauqua County, way from New York City. What did the county do different to protect the people once they learned what was going on in New York City? I say New York City because I think New York City got ambushed. I don't think they saw it coming, and they just were overwhelmed. So what happened here that didn't allow that?
Well, I think one of the reasons is we got ahead of it. Really, we made decisions, we made changes, we made implementations to our policies that got us ahead of this. And I tell everybody this, and it was ironically, as today unique with the passing of Justice Ginsburg, and I started following Antonin Scalia, and they had a unique relationship of admiration, but two opposite ends of the spectrum.
Yeah, agree to disagree.
Yeah, so it was Antonin Scalia made a comment about they questioned the Supreme Court, and his quote was, we're not final because we're infallible. We're infallible because we're final.
Right.
And I adapted that a little bit to my philosophy to this pandemic is I'm listening to everybody. So for the first week or 2 weeks, it was every night we were on a conference call with all the leaders throughout New York State, county executives, county administrators, and listening. So I sat back here, and as they're getting 15 cases, 25, 30, 100 cases a day, we're writing notes, and this is what you need to do, and this is what you need to prepare for, and this is how. So, that night was taking notes in my book every day, and I watched. First got into the business or the office, and people had a journal with them. And you would always document your meetings. Well, I created a specific COVID-19 journal, and that filled quickly with notes and comments and quips. So, we listened to everybody else, and having said that, we got ahead of it. And we took advantage of things when we didn't have the cases, we didn't have the outbreak. So I think having those plans in place for when that outbreak did come into Chautauqua County, we were ready to take it. But I want to go back, and it was Judge Cass who reminded me that quote wasn't Antonin Scalia, but it was actually from Robert H. Jackson.
Oh, wow.
As about the fill out. But it goes, and I've used that, and people kind of question it, but we did so well because we were one of the last to be affected. So our team, my team, every day, I'd come back the next day, and this is what I heard, this is what I do, and should we do this? And so it was a great deal of information. And Steve Aquario, and Dan McCoy, the county executive out of Albany County, and Ryan McMahon, all the county executives throughout New York State. We were in constant contact with one another. This is what I'm doing. Well, hey, this really worked over here. If you haven't done it yet, you better be ready. So having said and had that communication with everybody was phenomenal. And that's what helped us prepare the way we did.
That's the beauty of this show, is I get to ask questions about the behind the scenes that people never know. And it's darn if you do and darn if you don't. And they don't understand. This is not just somebody flippantly sitting in office and throwing a dart at a target and say, okay, this is what we're going to do today. There's a lot to it.
Yeah, it is. You surround yourself, and we usually have a fall conference with NISAC, which is New York State Association of Counties, and this year it's all virtual. So the other on Thursday was Tony Pacenti, the county executive from Oneida County, which my wife's family lives there, and then there was Pat Ryan out of Ulster County.
Okay.
So County Executive Ryan said. I just been in office a year in June, and this happened, and people are texting me, in the chat room. Are you going to say something? Are you going to say something? Because I was the newest member, and NISAC and Steve Aquario knew very fondly that I was in office 3 months when this hit, and prior to that, wasn't involved as heavily as I was the county chairman of the legislature involved in county government, but to the magnitude of what was happening.
Yeah.
So it's interesting. It was unique that within. But I think having said that, you going back to how I've based this, you surround yourself with good people. My office staff is incredible. My sometimes I call it the control room, my control room, because that's what we call the Western
Yeah, you
region.
got to have some room.
So our response team control, we always then the talk and the debate. Sometimes we get off topic because of something that's happened or what's passed from the governor's office, and we see the challenges we have here in the county and how we overcome those. But it's just, you surround yourself with good people. You listen, there, like you said, there is, what goes on in public, what you see, what you hear from us is about 1/1000th of the iceberg and going on every day. And the other part of this too is what I realized about 3 or 4 weeks into this is the rest of the county was still running. I reached out because we had something going on. It became public with Petrie. that started in February, just before this.
I remember.
I reached out to Mark Ice, our IDA director, Rich Dix. I said, hey, what's still going on? We still good? Because you're listening to businesses in Buffalo saying, oh, we're not going to come out of this. We've closed down. We're losing revenue. I'm like, here's a guy who was ready to put his own money. And are we still there? And ironically enough, you listen that, HR would say, oh, yeah, we've been in contact with Steve Abdallah with HR. I'm like, okay. And then you listen to the IDA and you listen. So not everybody just put the brakes on and we're waiting for us. They were phenomenal. It says a lot about our employees throughout Chautauqua County. They were right back to work, and to them, they did their job while listening to what was changing every day. So, hats off to them. It was a great feeling knowing that that's what was going on. Again, behind the scenes, the rest of the departments in county were running in an efficient manner, and business was still going on. Because right now we were just focused on the health concern that was coming out.
Calm heads prevailed.
Yep.
I was thinking when you said March 15th, and that's going to go down for us in infamy. And I think, there was a celebration about the man on the moon and this and, 911. This is going to be one of those that we're all going to remember. It's funny. This past year, I was the president of our Rotary Club in Westfield, Mayville. You saw me talking about them earlier. And they started referring to us as the pandemic presidents. That we all of a sudden, in our very little small way, we had to figure out ways to keep our clubs running, and we did. But it took a lot of thought and a lot of creative juices. And the other thing I was going to mention, you said you have a pandemic log. Mm-hmm. I'm the town historian now in Ripley, and it's unsightly, I'll admit, but I have a box, and every week I dump the newspapers from the week before in there. I have chronicled since, anyway, probably back to May or April, all the newspapers, because it was like historians, they clip out little things about this and that. It was like, where do I begin? Where do I begin? You take the whole newspaper back in April, whether it was sports, or medical, housing, the economy, everything was pandemic related. So I have crystallized, I've memorialized the newspapers, if you will, to someday just like a time capsule. And then every week I just sit down and write a paragraph. This is how I see things. Nothing political, just where are we at with this pandemic? Because it has to be chronicled. We have to learn from it.
Certainly, and that's one of the first things they told everybody is, whether it's your county historian or somebody in your office that, and I've done it. I've got every daily. It was a 3-ring binder, and now it's the industrial 3-ring. And every day is our report. The number of cases, where they were, and I could go back to April and March, and look and find these out. And then we looked at the governor's press conferences. We kept all those, and for the longest time, I was keeping all of the. I still do, keeping the executive orders, which I think we're over 60 or 70 now from the governor. So, yeah, we were chronicling, and that's one of the things that they said is chronicle everything, because you don't want to throw it away. And I guess at some point, and they say at some point you look back on things and laugh. I don't know how that'll ever happen, but I think there's things that we've said it already. Remember when we thought it was going to be this way, or we should have done it that way? So
I was wearing my mask inside out and didn't know it.
And it's funny you mentioned Rotary. So I've been involved in Rotary just through my daughter. Okay. So the District 7090, she was an exchange student in the Czech Republic. So
super.
Imagine you take over this job, and now you've got a child halfway around the world, and what do you do? And relied heavily on Rotary and their experience and the professionalism. I can't say enough about the system and the Rotary clubs, international and here from the district. But it was unique. But she was over there, and we were going back and forth. And uniqueness about that little piece is we were driving in October. We were driving to Brockport, my alma mater, for college, and for a football game. My wife was on Zoom or FaceTime, whatever we were doing, and listening to the Bluetooth in my car, and I'm like, we're the Jetsons. My daughter's halfway around the world. We're looking at her on a television, listening to through my car. It was ironic, but it's all those things that you remember from 2019. But that whole cycle for me, as you probably do, my year is still September through June. That's my year.
Yeah, it's our school year.
I'm not used to the January to December piece yet. As a school year, it was always hard. But going back, the focus on what was happening was important in chronicling everything. And you looked, and that's what she said. She goes, Dad, we're wearing masks over here. You can't leave the house or you'll be arrested. Well, here, if you were to say that, you think of what people would do and how they would react. But she's like, Dad, over here, 20 years ago, they were a communist country. So they knew if you left without a mask, people didn't, they weren't seen much after, if they were in prison. So having said that, there's just a different understanding. And you look at those countries, and I think at that point, and I have to look at the numbers now, but I think the Czech Republic only had 10 fatalities nationwide.
Wow.
But it was that early intervention. And even, a lot of the things we did was just before or just after. So the masks, my daughter had been telling me, Dad, we're wearing masks over here every time we go out. And I was talking about my team. It's early on, March, nobody was wearing. In fact, we were here doing our PSAs. Nobody had masks on. And finally, I said to my team, I said, let's do it. Just tell people to wear a mask. It's not going to hurt anything, right? We're going to be okay. And so just as we were about to make that announcement, how do we roll it out? How do we get the message? The governor came out and says, everybody will wear a mask. I said, okay, good. So we know we're on the right track.
It took pressure off me.
Exactly, a little bit. So that was, it was interesting. But throughout this whole pandemic and situation and crisis, a lot of the things, if again, behind the scenes, if people were to really see where things started, and not puffing our feathers or patting ourselves on the back, but between the senator, the assemblyman, and myself, the regional concept that is used statewide. You could go back and find a document that was presented by Andy Goodell and George Borrello as to how that would be laid out. The template format as to businesses going online, documenting their safety plan, documenting everything they're going to do, and turning it to the state. We sat down with the IDA and the chamber and said, hey, let's do this 5 weeks before the governor ever did.
Yeah.
So again, and as we came into phase one, I remember getting a call from our contact in the governor's office who's part of our control room, and they said, duly note that a lot of what you've done has been recognized in Albany. So I think, again, hats off to how we reopened, hats off to how we created or protected everybody throughout this pandemic, and how we're still doing it. And that I think is, we talked coming in, I think the challenging or frustrating piece now is, where do we go?
Yeah.
We've been open for 2 months. We've been in phase 4 since June 30th. What's next? I proposed, to the governor through Kathy Hochul, our lieutenant governor's in our control room every time we meet, and she's a champion for Western New York. And I said, could we look at more phases? Not that you want to restrict anybody, but just gives us something to look forward to. If our numbers stay down, because if you look at, we're like, okay, we're open, we're phase 4. Why am I wearing a mask? Some people's attitudes, but you'll see that how things have happened. We had an uptick at Fieldbrook Foods. We had an uptick at SUNY Fredonia.
Yep.
And as they say, is this the second wave? We're cautious here because we didn't have a real impacting beginning to COVID-19. Our numbers were low, stayed low, and I was trying to tout that. We're still low here. What's in Chautauqua County? We're 1% or less infection rate, and we weren't testing a whole lot, but even as we started to test, the numbers still remained low. So, we kept that in mind as we were going through. So now, we saw these upticks. And if you look at the data, we switched now to reporting to zip codes. Our cases where they're coming out now are in the northern part of the county where they originally started. So is this phase 2, second wave? Could be. We don't know. With this, you just never know. We don't look at anything. And really, I think a lot of, whether it's state representatives or county or locals, you look at it, it's like, okay, I guess this is the second wave as it goes by, but you don't really know. And it's so
subtle.
It's so novel. I mean, that's, people have said, why aren't you stopping this for the flu? I said, we know enough about the flu. We just don't know anything about coronavirus to the extent we could, really make some good solid decisions early on.
Okay, take a breather. Folks, you're watching Chautauqua Sunrise. I'm Doc Hamels, and my guest today is P.J. Wendel, County Executive here in Chautauqua County. And we're talking about the pandemic, where we've been, where we are, and where we will be. One of the things and if you do have a question or comment, give us a call at 753-5225. PJ, one of the things that I watched very carefully in your Monday morning memos and your daily memos that you were sending out to whoever you sent it to is confidentiality. Could you speak to that? Because right now in the world we live in, everything is right there. Something happens, 3 seconds later, somebody has it on Facebook, and there's no time lapse. People don't understand when you're running a big system, there's time lapses and confidentiality barriers you got to deal with. So could you speak to that a little bit? I think that would be helpful to everybody.
Well, certainly. One of the things, and we talked a little bit when I first, before the show started, when we first started reporting cases, we were reporting the age, the gender, whether they had a local travel history,
right,
and then what town they lived in. Well, those started to happen, and within minutes, people were texting me, this is their address, this is their phone number. Delete. I don't want to know. And again, understanding with HIPAA, and being involved in the medical field to the extent I've been, I understood the importance of that. And what had happened was everybody had different ways to report. So as it started, and Christine Schuyler, so the county leaders all have our group we talk to. Christine Schuyler has all the health directors they talk to. John Griffith has all the emergency services directors. So we all have these little silos that all fold in together. But she had talked to the Western New York Health Alliance, and they said, "What do we do?" And they came up with the agreement that the 8 counties of Western New York would not post the zip codes. Cattaraugus County came in and said, "Hey, Jack Searles, I think, had brought it to my attention, or Kirk Crandall from Allegheny. They were getting threats on social media, to the individuals who they suspected as being positive." And, right along, and I continue to say this, my responsibility is the health and safety of our residents, both physically and fiscally.
Yeah.
So keeping that in mind, I said, we can't post zip codes in that much detail because the information, we're a small community. the argument was, and I like the way people always refer to us with Erie County, because if again, behind the scenes, if I told you everything Erie County has and what we don't have, I appreciate people trying to compare us, because we're very, very one-tenth of what they are. But having said that, the town of Amherst itself is as large as Chautauqua County with 3 zip codes.
Oh, easy.
And you could get lost in announcing somebody from the town of Amherst in a zip code.
Right.
In Chautauqua County, if you said we have a case in 14750, it's going to be a matter of minutes before somebody calls me and said, hey, I think this is who the person is. So we wanted to avoid that. And because of the size of our county, it was challenging. And people, and I think the most disappointing thing or difficult piece was, because of the national media and people's belief of a conspiracy with all this, that we were hiding something.
I noticed that. Yes, there's conspiracies every day in the new one.
And it was challenging because, why aren't you telling us about our hospitalizations? Oh, we don't have any. What do you mean?
You got to have them.
We don't. Really, we don't. And, those are things that we were talking to people about. And even, as we progressed and, every day we were putting out videos in the weekends. I've got my own little studio at my house. I would, sit in front of the curtains and I would have all my data and my family. My son was my videographer with my phone and do the video and get it out. And, we have no new cases to report in Chautauqua County, no hospitalization. So nothing was happening, for week after week after week. And we were like 7 days without any new cases. And we were proud of ourselves for what we had done as a county, not my team but as a county, what we'd done. And then, so we stopped doing things, and it really wasn't a whole lot of, questioning. It's like, okay, people were saying, well, why aren't you doing it? You should be telling us. Okay, here we are. Nothing happened today. And we didn't. But my point is, I want something to be. Going back to with education and teaching, you want it to be meaningful. You want it to be valid. You want it to be reliable. So if we just say there's nothing, it's kind of lull people into a false sense of security in a respect. So, and then all of a sudden we started to see the change of our cases. So we shifted gears and went back to reporting the way we were early on. But that confidentiality piece is big. People. And to the point, a lot of discrepancies about the Fieldbrook Foods incident. Some people claimed we knew for weeks. Wasn't the case. And if you go back to chronicling, and it was documented that people said, well, right around Memorial Day we had a large case of 10 people and they were all related. So was it prudent for us to say there were 8 people of those 10 cases that day, 9 were related to a family event? Do we say the family or the event because people would know where it was from? And It's just not fair. We didn't say it per se, but the connectivity would happen. It wouldn't take long for people to do the investigating as to who it was. So we've had to keep all that in mind. And people, I know for some reasons they have their beliefs in that, but it's really the confidentiality. 1, from a legal standpoint, but 2, just the protection of the people, knowing that we're here to protect them on all facets, not only from the disease, but and what I was afraid of most, and we all said this, when there was the comment that the Amish were just, they weren't paying attention. It was rampant in the Amish community. To the contrary, we went out, myself and the sheriff went out on several occasions to the Amish leadership, and we had a great relationship with our Amish leaders in the county. Some were a little bit more understanding than others. There are different factions here in the county. So having said that, people got nervous, and it's, and I told people, I said, you make your own, I'll give you the data, you be the detective, okay? Yeah. Our Amish community are in, Conewango and towns of Poland and Kennedy and out in the 4th Battalion. Yeah. And then if you go into Clymer, they're in the 3rd Battalion. So watch those numbers. If you see a spike in the 3rd or 4th Battalion, well, they're just not telling us. Well, they have to. They have to be tested. They can't, there isn't an Amish hospital where they just go in and get tested. They were still going through the English system with us. Sure. So we knew things that were happening. Yeah. And, it just was, it's unfortunate, but that confidentiality piece and social media, as much as it's helped us, in some cases was a hindrance, because something get posted and, to check it. And we've talked about this. Our media, Jack DiAgostino from the Post-Journal and the Observer, Eric Tishy, Dennis Phillips, all these guys. I don't want to leave anybody out from the media, but they always validate their stories. They always go through and do their investigative reporting, and that's what we need. But social media doesn't have that.
No, it doesn't.
So anybody can put on anything they want, and
I
people
never
believe it
noticed
is
that,
true.
PJ. Oh man.
So it was a challenge, and we rely on those media partnerships and really getting the information to them. They've been phenomenal. I mean, our media has been great. Anytime we need them, whether it's radio, television, Mark Gosh Gary with Spectrum, the radio stations, Jason Sample, Terry Frank, Dave Rowley. I don't want to miss anybody out.
WRFA, yeah.
You know, Dan Warren, and I would call in on certain occasions and say, "Hey, this is what we're doing." You know, if I heard something to get the message out, because I'm really about the transparency of what we were doing, and that's the piece of all this.
This was pretty consuming, wasn't it?
It was, and I'm a movie quoter. And, there was a movie with Harrison Ford, and it was involving clear and present danger. But they talked that there was an incident with the president. And they said, you weren't friends, you were great friends. Don't give it anywhere to spin, to create. And that's what we've been doing with our messaging. Now, here's some information. Well, this is it. You can't take it anywhere. It's plain and simple. Whether people wanted to believe that.
5 is 5 is 5.
Right,
Yeah.
but that's how we were presenting it. And I think it really, people did focus and trust that. And our message had been constant the whole time. Even with, the uptick in Fieldbrook Foods. Our message, when that first happened, there were incremental cases all along.
Yes.
And there was a unique, again, not getting into the weeds with it, but again, to protect the person. There was one case that was unique, and that's where it kind of, piqued our interest. But, we've had over 500 cases, and those people have been employed, and has every business said, I have an employee that tested positive.
Right.
People have come out. We relied on the businesses to bring it out, and Ellicottville Brewing Company had a person test positive. Absolute of Westfield had one.
Right.
So again, we relied on them to bring the message out. And as Tanglewood had the issue, and with Fieldbrook, what really tripped the alarm was on a Thursday, they had a screening process. 100 people failed the screening process. So that's when we shifted. The plan was in place, and within 24 hours, notified everybody. All the players were together, informed the mayor, so everybody was up to speed, and the plans were set to have the testing. So, things did happen rapidly. People said you waited. We didn't wait long. But to the point to coordinate State Department of Health, Chautauqua County EMS,
Right.
everybody, it does take a little time.
Well,
But
and getting back to what I was saying, everybody thinks, you watch TV like these cop shows or NCIS, and they get the results immediately within the show. It's just the real world, right?
Yeah.
So you got to wait through this. All right, so we know where we were. We know where we are, I think, at the moment, and it seems like we're under control.
Yep.
My biggest concern, walking around the area, and we're down to about 2.5 minutes, a sense of laxness. It never happened here. I'm really worried. We're going into the winter season, Christmas, Thanksgiving, indoor gatherings. What's your message in the next couple of minutes here?
Well, I mean, the message today is going to be the same as message, the 15th of March. Wear your mask, socially distance, avoid large groups, wash your hands, hand sanitizer. The message hasn't changed, and it can't change. Just because it doesn't happen here doesn't mean it can't happen here. And if you, there's analogies you can look at. We prepare for this. My dad was building a house, and there's hurricane strips on his house in Russell. Well, I don't know the last time a hurricane came ripping through Russell, Pennsylvania, but you still have to prepare for it. And it's the same with this. We still have to wash our hands. We still have to, and it's really simple hygiene and disease prevention is what we're asking people. But, even though it's not here, just like it wasn't in March, right. It wasn't here at the beginning, but it doesn't have to be. Take our words for it. It's here.
It's here.
And we need to focus. So, I was proud. We did have a person over the age of 100, and they were positive, and they fully recovered.
Priscilla Swanson.
Just a great. It's a great positive thing to come out of all this. But again, that lifestyle she had, very healthy, very active lifestyle, and that's what we're telling people too. Go back, get out, get some fresh air, be out in the public, but. You can walk down the street without a mask as long as it's just you and your family.
Right.
But when you come close to somebody, put your mask on. Or, we need the gaiters. You can pull it up. And, I've got masks that I wear that, they kind of fit over my head, and I'll slide it down when people get close. But to that point, it's become second nature to wear your mask and those things. But we just can't lose sight. And the discipline, that's what I've told people all along. I likened it to, my athletic career in college was a little bit different. We didn't have a regular college lifestyle. We had curfews. We had rules.
Right.
So if you put yourself through that discipline, you're successful. The same thing here. So many residents of this county have tremendous discipline, and that's where we're at. And that's what's helped us. And that's what's going to continue as we move on. But Christine Schuyler's made a good point. We talk about it almost every day with our response team. We have to learn to live with this pandemic. It's here. We don't have a vaccine, and even with the flu. So, go back to education. We'd have as many as 15% of our population out with the flu.
Right.
We still didn't even, it's like you didn't even miss a week. As a teacher, it's like, how about a day? Maybe too many. But to the most part, as we move on this, right now it's scary. We don't have all the answers. But as those, vaccines come about and as things happen, we need to learn to live with this and take those precautions.
All right. Folks, you've been watching Chautauqua Sunrise. My guest today has been P.J. Wendel, the county executive here in Chautauqua County. P.J., thanks for taking time and sharing this with the storyline. This has been really enlightening for me. Folks, I think the message is keep up the good work, be disciplined, listen to what he said and what we've been saying right along. Carry that mask. I've got one in every pocket of my clothes, I think, now, in every vehicle. So please be safe out there. Think about what we talked about today, and hopefully we're not going to report big numbers in the future. Thanks a lot for being my guest today.
Thanks for having me.
We're going to see you in the fall. See you next week, and have a great holiday. There's no holiday weekend. We're going to celebrate fall. There we got holiday. Celebrate fall. I'm into Thanksgiving already. All right, folks. Have a good weekend. Enjoy the nice weather. Bye now. Bye.